Hey everyone, we're just gonna wait for a couple more minutes and then we'll get started.
Hi, everyone. Welcome to day 3 of the Powerful Feminine series featuring powerful South Asian women. Thank you so much for joining us today. My name is Natha Vishwanathan, and I am a junior in the School of Foreign Service, majoring in STEA and computer science.
Hi everyone, my name is Hasmi. I'm also a junior in the School of Foreign Service, majoring in regional and comparative studies, and we're gonna be your moderators today. And we are so excited to have you joining our celebration of the Divine Feminine with our Navarātri speaker series. So if you have any questions during the session, feel free to drop them into the Q&A box and we'll have some time at the end to answer them. And today we are joined by Professor Krishnan, who is a medical historian and focused primarily on diagnosis and clinical reasoning. She is currently writing a history of diagnosis and notes how this very practice parallels an investigation done by detectives. She also studies the relationship between medicine and health equity and the history of health disparities. And this work promotes the need for better medical practices, which can help marginalized communities receive more personalized care. Thank you so much for joining us today, and we really appreciate your time.
Thank you for having me. I'm really happy to be here.
I think the first question we want to start with is what sparked your interest in the medical humanities field, and how did you end up going into medicine?
Thank you. Well, it's as such stories go, it really starts with my childhood kind of fascination. So I always loved reading and science, and I loved narrative, and I loved experiments, and I really enjoyed the kind of discursive aspects of figuring out an investigation. I was always really interested in like treasure hunts and detective quests and things like that. And so these were my cognitive interests that were always very linked. But as I was coming up, particularly in high school and college, I also had very strong interests in and commitments to social justice. So all of these things sort of fit together. And as I was thinking about what field or what fields would allow me to use this investigative brain, but also be really attuned to narrative and stories, to be in community with people, to be with people during some of the most difficult and meaningful moments of their lives, and to serve and to alleviate injustice. So as I was thinking about all of this, I whittled it down to journalism and healthcare. And actually, the decision to go into medical school was a relatively late one. I spent most of my kind of growing up thinking I was going to be a writer or a journalist, and it was a pivot that I made in college, actually. But yeah, that's how I made that decision. And so I guess in some ways I've always been interested in why things work and how things work, or don't work the way that they do. And because I'm terrible at calculus and physics, I didn't become an engineer, and decided to use words and arguments as my toolkit. And so from then on, really from college onwards, I've always spent time kind of toggling between the humanities and social sciences and natural sciences. And to me, these connections felt pretty organic. It felt like they were using a lot of the same tools, as I said, but it seemed like they were siloed in disciplines that weren't really talking to each other. So for me, discovering the medical humanities, or discovering that this field where all of these forces could be in some kind of conversation, was really a revelation. And as I kept studying this and met more people in the field, I just found more intersections.
Yeah, thank you so much for sharing. You spoke a lot about the intersections of different fields. What would you feel is the most rewarding part of your work?
So I think the most rewarding part, and this is not to draw kind of a false equivalence between these two things, but it's students and patients. And again, these are not equivalent things at all, and they're very different in their own ways. But speaking to my interactions with students, I think we've all had those moments when we're in a classroom or in a seminar. I remember this as a student and now as a professor, when everyone has that kind of collective aha, where we realize, in some ways, that all of the things that we've been talking about are either we're having a really, great moment of agreement and collectivity, or we are in contention and critique, but it's still really positive. I mean, those moments are, I think any of the faculty members listening to this can definitely say, those are some of the most rewarding moments that we can have, because we kind of spend our lives hoping to have those moments. And I learn from my students every day, even texts that I've read numerous times, even arguments that I myself have authored. It's so rewarding because it's always kind of a fresh set of eyes. I really, really treasure also the conversations that I have. Sorry for that noise. The conversations I have with my students outside the classroom, and you kind of discover all of these different stories and backgrounds that people bring to their engagement in the classroom. So that's really, really rewarding. And sort of on the flip side, on my clinical practice, seeing patients is, it's both the most challenging thing that we do, obviously, in medicine, because the stakes are high, but those breakthrough moments, those aha moments, at least for me, selfishly as a physician, I can still remember them, very, very clearly, even ones that happened a decade ago. And these are, really moments of connection. And they're not that different from the moments that I was describing in the classroom, where you realize this is why this encounter is the way it is, or this is where this person is coming from. This is what happened to their parent. This is, all of these things that we all bring to every conversation and every encounter. So I would say those are absolutely the most rewarding.
So as a woman in the medical field, what are some of the changes that you've seen over the course of your career? And specifically, what is it like being a South Asian woman? And especially, I think over like the past few months, the whole idea of women, always being under the microscope in the medical field, I think really came to light. So, what was kind of the impact of any of that on you, if any, and how can, women really go forward from here and take that ownership of the field that they serve?
Yeah, thank you for that. I think it's an important kind of series of questions. I'll take the first one, which is what's changed over the course of my career. And I should say that, I'm still developing in my career. So I certainly don't want to sound like I have a sense of the whole longitudinal arc of medicine. I'm still relatively fresh, relatively new. But one big difference that I would say is that interdisciplinarity, when I talk to you guys, basically, interdisciplinarity is much more familiar to you than it certainly was for me when I was in college. And it seems like it's become more of the coin of the realm, right? There's less surprise when I encounter somebody who's studying English and wants to go to nursing school, or somebody who's studying history and wants to get a public health degree. Programs like STIA, right, that are just so interdisciplinary. That was a discovery for me when I was in college, and every stage of my training since then has been kind of a series of those discoveries. So I think just this sort of, we take it for granted a little bit more now that disciplines have something to learn from each other, that we should be in conversation, and that separating us or siloing us is not the way to tackle problems. And, I won't spend too much time on this, but speaking to, for example, the COVID-19 pandemic, this has once again just uncovered, right? Like all of the ways in which, let's just take the example of health and healthcare, are interlinked with socioeconomic issues, racism and racial and ethnic disparities, political context, public health, communication, information dissemination, how we test, technology, right? Like all of these things have come together in this kind of brew, and we're understanding increasingly that we cannot solve this crisis without those fields in conversation. So that has been a big, and I would say a very positive change in my view. In terms of being a woman, a South Asian woman in academia and in medicine, so I'll speak to the kind of South Asian context a little bit specifically. We occupy this kind of complicated space in America, right? Like in the medical field, my field, we are disproportionately represented. But in the academy, especially if we think about the humanities and social sciences, were not. So there is a kind of tension to navigate there. And our identities as women, as South Asian women, as potentially religious minorities, there's a lot going on there, and they intersect in really important ways. There is racism and sexism. I don't need to belabor that point, that we experience, but we also, and if I speak realistically, we also occupy a place of a lot of privilege, especially in the American context. There is this, this notion of being a kind of model minority. That is its own thing, right? So for me, it's very interesting because I was born in India. I grew up in the UK partly, moved to the States, and then I went back to the UK for graduate school. So I've spent about a third of my life in the UK. And when I was a child growing up there, I wasn't as aware of sort of what was going on. But after having lived in America for a long time and going back there for graduate school, I experienced so many very blatant forms of racism and sexism that I frankly had not experienced at that point in the US. And it was very different. It was beyond what I experienced as a Indian American growing up in Tennessee, like I grew up in the South. So they were still different. And in some ways, I think it really opened my eyes to some of the experiences, particularly of underrepresented minorities. Like when I think about my colleagues in medicine who are African American, Latinx, Native and Indigenous physicians, I do think my experience in the UK and coming back really changed the way I thought about their experience. So something I'm still thinking about and hopefully growing and can, kind of implement is how do we as South Asian Americans, as South Asian American women, how do we both navigate these spaces, sort of for ourselves, but also be allies, be colleagues, be friends, right? For those who are less privileged in these spaces. Does that answer your question?
Yes, definitely. I think I have something of a follow-up to that. I think when, a group isn't represented in the healthcare field, there's just so many instances of, studies being conducted that aren't holistic, that aren't taking into account a lot of factors. And then from there, the conclusions are just inapplicable to a lot of communities. What are things that can be done to kind of work on that and make healthcare and the institution of healthcare less racist?
Yeah, that's another excellent question. And this question can be sliced in a lot of different ways. But let's just take, for example, something like big clinical trials, right? Which I think you're kind of maybe getting at, like this idea of how we build data, how we build evidence in medicine. And this is where, right, if I may foray off a little bit, this is where the humanities and social sciences are very important when we're conducting scientific studies, because the scientific method tends to be very inward looking, right? Like the idea is that, because it's an experiment and it's verifiable, it is unbiased and objective. And that's patently false, because as you're saying, Hasni, the issue is some of those clinical trials, for example, they enroll mostly older white American men. Now, how do we extrapolate from one of those trials, for example, when I have a Black patient come in or a South Asian patient come in. One of the things that I think is very interesting is there are lots of movements now toward how we enroll more diverse people in research. We're battling against entrenched histories. So with particular communities, distrust of the medical establishment, distrust of scientific experimentation potentially, cultural kinds of barriers. So that, this is where like grassroots work is really, really central. So I'll give you an example. I did a lot of my medical training in Baltimore, and the institution I was at, there's a very complicated relationship, particularly with the African American community in that part of the city. For better or for worse, there are some positive aspects to that relationship, but then there's also a deep, deep distrust that goes back to the 19th century. Now, the question has been, how do we, for example, enroll more African American patients in the trials at that institution or the studies that institution is doing in partnership? Some of this is getting communities involved, getting community leaders involved, making sure that the decisions, if you all have heard of the term community-based participatory research, that the decisions are not made by the kind of hierarchy of researchers, but by the people who these data are actually meant to serve. That's one thing. I have colleagues who are working on issues like cardiovascular disease in the South Asian community. We have a very, very disproportionate burden, right, of non-communicable disease, chronic diseases, diabetes, hypertension, coronary artery disease. And yet, when we make decisions on medications to give to a South Asian patient, we're basing those on, as you said, trials that have not been necessarily inclusive. So these kinds of networks, clear information communication, as I said, bringing community stakeholders, having patient-centered kind of activism and support groups. These are all absolutely critical. And I actually do think, if I may forecast a bit, that I think that this pandemic has engineered some sort of change in that direction. This work has been going on for a while, but this might just be, kind of the tipping point.
Thank you. Given that, this is a series featuring strong and powerful women, I think we'd love to know a little bit more about how you draw inspiration from Navarātri, and are there any traditions that you grew up with that you'd like to share with us?
Yeah, happy to. I mean, Navarātri is interesting, right? For so many reasons, not the least because there's like a heterogeneous way in which it's celebrated across India, which is really interesting. I mean, I don't need to tell you all this, but this, like, the centering of feminine energy is super important. Embracing the many faces of Durga, which I think I certainly take a lot of inspiration just from the figure of Durga. And the many forms that this feminine energy can take. I mean, what I love about it is it's not a singular or homogenous form of the feminine. There's so many, right? There's the 9 forms. And I also love the autumn. I'm a November birthday baby, so this is like my season. So I really get strength in the autumn. It's a time of renewal, which I think we think about a lot with Navarātri. We plan for the next year. We've reaped the harvest, but we're also going into a fallow period, if we think of it as like connected to the earth and seasonal, where we're reflecting and meditating. And I think for all of us, if I may say so, this year in particular feels like a real time of reflection, meditation. Where are we going after this? There's uncertainty, but also I hope some glimmers of hope. So I am really taking this time to do introspection on what I'm doing, why I'm doing it, what is my mission, what are my kind of goals, connecting with family and friends. I mean, one of the things that can happen when we all get really busy, I certainly do this a lot, is get very caught up in my work, to the point where sometimes you have to ask yourself, why am I doing what I'm doing, right? Like, what is the kind of recentering? And then in terms of tradition, so I'm from Bombay, right, where Navaratri is a big deal. So there's Garba, there's puja, there's like lots of food. I always think of my grandparents on both sides, who are no longer with us, but this was like a big deal for them. But going several generations back, my family is from Kerala, and one of the traditions that we have there is like initiating children into the world of letters. So basically like an elder holds you and you write, or they like help you write in rice. And so this kind of idea that Navaratri is also like literary and creative and narrative. So it has a lot of meaning. I have to say, in full confession, I don't do pujas or sort of like traditional forms of ritual myself. My mom does, so I'm sure I'll be calling her very soon. But I think that more kind of spiritual, meditative aspect of it is very important to me. Yeah.
So you mentioned that you have lived in like India, the UK, and the US. How, I guess, have you kind of felt your spirituality manifest differently in different locations? Because I know like when I visit India, I definitely am a very different person spiritually than like when I'm at Georgetown and when I'm at home. And then perhaps also like has like the pandemic influenced the way you kind of see religion, spirituality, the divine feminine, things like that?
That's such an interesting question. I haven't ever considered that actually. I will say that, and as I said, in full disclosure, I'm more of a cultural Hindu than anything else. Like I'm not an incredibly religious person. I would say that. But when I was in the UK, I definitely was more practicing. I felt the craving for that community. I mean, all of those things I used to mock when I was a kid, right? Like being dragged to pujas and going to like the gatherings. I mean, we had a kind of niche South Asian community in this part of East Tennessee where I grew up. And I used to hate having to go. But when I was older in the UK and like experiencing kind of life on my own and more of those things I talked about, I just craved it. So I lived in Oxford, which was not very, very diverse, at least the part that I was in. And I used to go to London to Southall all the time, which is a very Punjabi neighborhood. And I mean, I would just walk around and like just to hear Hindi and to be around like Desis was such an incredible thing. And, to the point where I would go to temple more, all of those things. So I think there is that, like, in a way, there's that craving that happens when one is in more difficult times. Now, it's actually something I've been thinking about a lot, this kind of finding a temple to attend or being sort of more connected to my community in that way. My forms of reflection currently, though, have been reading a lot of poetry. So I've been reading a lot of Tagore, a lot of Sarojini Naidu, and a lot of other favorites like Derek Walcott, and these other kind of Kavafi, like these poets, these sort of global poets who think about our relationship to place, to being nomads, to wandering, what borders mean, what migration means. I have found a lot of spiritual refuge and strength, particularly in this crisis, from reading, going back to those kinds of things. And I think there's a deep connection, right, between poetry and religion and spirituality. So yeah, that kind of answers your question.
So I think we have a few minutes here for some audience Q&A, and I think we have some people that are asking questions. The first question we have for you is, can you talk a little bit more or comment on comparisons of racial disparities and their impact on outcomes of patients during the 1919 flu pandemic versus the current COVID-19 pandemic?
Yes, thank you for that question. I can comment on that. One of the things I'll say, at the outset is that we have, obviously we have limited data when we're thinking about the 1918-1919 influenza pandemic. One of the things, and this is an area that I've looked at more recently, one of the things that is interesting is that from the data that we have, and we have limited data on the whole pandemic in general, but also particularly having to do with specific racial and ethnic minority peoples. But one of the things that we do see is that, speaking specifically about, let's say, African Americans, that they experienced lower absolute mortality rates than their white American counterparts, particularly in the most virulent second wave, which was, in the fall, winter of 1918 to 1919. At the same time, as far as we know, the case fatality rate, meaning that if you actually contracted influenza, like what was your risk of dying, was higher for African-American patients. And so that's an interesting link to COVID-19. The reason I think it's important to consider is when COVID-19 first happened, there were lots of questions about what prior pandemics we could look at for examples. And I think the disturbing trend is that obviously there have been disparities in almost all pandemics. 1918 flu, it's a little harder to extrapolate given these facts, but still it's useful because we can look at a lot of the same factors. So things like poor housing conditions, housing segregation, terrible access to care. So, Black Americans had a really hard time getting to hospitals. If they got to hospitals, they were sent to, like the basement, received substandard care. There was a lot more community kind of healing, a lot more home care, all of those things. But at the same time, in an odd twist that's sort of different from our current time, segregation may actually have functioned in a protective way, kind of quarantining African Americans away. And that might have been one of the reasons that they were less likely to get it in the second wave. So again, I could speak much longer about this, but I'll keep it brief. Many more kind of comparisons to be made. But in terms of the second part of that question, which is whether I currently practice, I do. I practice inpatient medicine. And the rest of my time is, academia, research, and teaching.
All right. Another audience question we have is, have you seen spirituality impact patients? They've heard of hospitals in India bringing in spirituality and treatment. I also know that hospitals have, chaplains who work there as well. So.
Yeah, absolutely. It impacts patients. Absolutely. It's, I don't know what else to say in terms of, whether it's verifiable or kind of data proven. There's a lot of work being done on narratives and spirituality. And I'm pretty sure, again, I don't know the studies, but there have been studies looking at religious interventions, having chaplains, having imams, having those religious figures available to patients. Obviously, there's so much we don't understand about the mind-body connection, about illness, about immunity and healing. And yeah, it's critical. Pastoral care is absolutely critical. So yeah.
I think the last question we have for you today is, we're joined by college students from Georgetown, Yale, Princeton, and other DC area schools like Hopkins, GW, and American. Do you have any advice for college students that are listening in today?
Yeah, I would say keep questioning, keep pushing back. You're inheriting a very complicated world. We should have done a better job. Wish we could give you something less messy, but we are where we are. And people will tell you no. They will tell you it can't be done, that it shouldn't be done, that you're not the person to do it, that someone who looks like you shouldn't do it, and just ignore them. There's a poem that I really like by Ron Kirchie, and he says, "Give up sitting dutifully at your desk, go out into the world." And so I can think of no better advice.
Thank you so much. And thank you so much for joining us today. We really appreciate everyone taking the time to help us celebrate Professor Krishnan's wonderful achievements.
It's a pleasure. Thank you for having me.
And if you're interested in hearing from more of our speakers, please tune in tomorrow from 5 to 5:30 p.m. Eastern. It's the same Zoom link, and you can hear from the Jakaria sisters, who, if you don't know, are TikTok famous trio of dancers who do Bollywood fusion dances. So we look forward to seeing you then.